There is nothing better than to talk about the health of our community. Isn't that right, Natalie?
Guys, can I just say for a second, Desmond is getting so good with his segues. Like, I have really watched him blossom over here, and I just needed to acknowledge that. Um, yes, moving towards a healthy society
We're moving away
means,
from one.
well, I want to move towards one. I was going to say, moving towards a healthy society starts with getting rid of RFK Jr. And the reason I say that is because NPR, among a bunch of other outlets, have talked about this and said recently that RFK reported on, overhauled the CDC's vaccine panel. Until recently, you probably weren't even hearing about the CDC's vaccine advisory panel because it was working and it was a thing that we didn't need to know about on the day to day. This panel played an important role on determining which vaccines both children and adults should receive, what gets covered by insurance, and which shots are made available free of charge to millions of, in particular, low-income children, okay? So the panel's decision really impacts all of us. But our health secretary, I use that term loosely, Robert F. Kennedy Jr., took the unprecedented step of dismissing not one, not two, but all 17 members, all of them, you guys, from this panel on Monday. 2 days later, then he announced that he'd be replacing them with 8 people, and several of his selections rose to prominence during the height of the COVID-19 pandemic, where they criticized government policies on school closures, on lockdowns, and the vaccine itself. One of them served on an advocacy group that warned against vaccines. So he replaced a functioning advisory panel that was based in science and in evidence that expanded far beyond the scope of COVID-19. And he has basically eliminated all of them and put in place a bunch of skeptics and activists in the anti-vaccine realm. This is absolutely a devastating situation. It means that our insurance may not cover a lot of things at this point, if you even have insurance. It's going to guide how doctors will practice and be able to recommend things. It's basically going to make it so that vaccines most likely just won't be in stock now. And I don't mean just COVID, I mean vaccines. I don't think people are understanding the level of danger that we are now in, to the point where there have been letters now written by doctors from all over the country, basically standing against this. This is one of the first things that we've heard of from the medical community. This is how bad it is, because the medical community, they don't really get involved. They don't really talk politics. It's really hard to get them to stand up for anything. And the fact that so many of them are saying, guys, this is really bad. Holy heck, does that mean that it's really hit the fan? It's basically going to make it look like that vaccines aren't important and that vaccines aren't necessary, and that they're basically going to start, this will start to defund entire programs around public health and safety. And so I wanted to bring this to the forefront because this just happened this week, but because so many things happened this week, this kind of got lost in the shuffle, which I do think is in part intentional. But this is an incredibly dangerous thing that we are dealing with. And at the very least, there needs to be a massive call for RFK Jr. to resign from the Department of Health and Human Services. He is not fit to lead, but he is going to kill people because of this. And I can't understate that. That is not hyperbole. That is reality, because if children aren't going to get vaccinated, children are like little germ vectors, and they're going to spread a lot of things to a lot of people, and a lot of people are going to die because of this. And so I'm just concerned, Desmond. I'm just concerned.
I mean, I don't know how the response would be anything other than to be concerned.
Yeah.
Right? I mean, because, like, honestly, even people who on the right who were skeptical of vaccines, like, they weren't anti-vaccine completely. I mean, a lot of the people who I heard who were bringing up their concerns with vaccines, it was usually to the effect of, should we be giving vaccines to children at a certain age?
Mm-hmm.
Not should we be
Mm-hmm.
giving them vaccines at all? Are we sure that the vaccines are safe? Like they were never saying they don't want to take vaccines at all. I mean, some of them were taking that position. Don't get me wrong. But if I'm talking about like the mainstream conversation around the suspicion vaccine people, it was at what age are we sure a vaccine is safe? Never like I don't want that at all. So if you're taking it off the table completely, like that is even anti the most to the a certain point. That's the most extreme position that you could possibly see on this issue. And I just do not understand like how someone's actually able to get away with this. I mean, what we have been seeing from the Trump administration right now is there are so many gaps within our government that we did not even know existed. And we always assumed that if something happened like this, that there would be certain checks in place, certain balances in place. Someone would come in and make sure that things truly didn't get off the rails. That whole notion has been completely dispelled now because things are continuously going off the rails. And it feels like no one is showing up to do anything about it. Everyone's throwing up their hands and they're like, I don't know what we're supposed to do about this. How do you stop RFK from doing this? Apparently you can't. Right. And that is scary because like we have created systems in our country that give so many people these unchecked powers. And if courts step in and say like, you can't do that, they'll just ignore the courts. And then what? And then what?
And then what?
Yeah, so I mean, that's really the question that comes after this, right? Like, what can be done about RFK's decision here? Because we could protest about this, right? And I think people should. People should publicly call for him to step down. But how do you actually pressure this to change? I mean, seriously, he's an unelected person to a degree. I mean, he's appointed by the Senate, granted, but like, he's in a position where you can't really be removed other than by Donald Trump removing him. And Donald Trump's not going to remove him. So we're kind of in a no-win situation right now. But I do think, nevertheless, even if we can't directly get this man out of office, I mean, this type of information has to be shared and shared widely because unfortunately, because of everything that's happening right now, because Trump is throwing everything out the wall, and I mean everything out the wall, stories like this, with how important they are being lost in the shuffle because so many different things are going on right now.
And I also want to just add, and this just popped in my head as you were sharing your impactful thoughts, that he promised he wasn't going to touch this when he went through his confirmation. So he just, I mean, we all knew he was a liar. Like they're all, you know, they all lied, but like he promised that this wouldn't be touched. And the people that grilled him on that said, well, I'm going to vote for him, but only because he promised not to do this. Like, oh my gosh, now what do you think? Like I'm just at a true loss for words because no one person, to your point, should have this much power over our public health system. And I think this speaks to the fact that one time, a long time ago, when we had these conversations, right, when we started doing these lives, I said to you, I didn't know it was this easy to basically overthrow our government. Like, did you know? I didn't know. I thought that things were taken more seriously than this and that there were a lot more checks and balances than there actually are. And so I do think that not only once we get on the other side of this, however long this takes to get on the other side of this, there is an opportunity to reimagine how we set this system up, because this should not be a thing that one person, an unelected person, can say, no more vaccine panel, no more advisement. You guys are on your own. And hopefully some states I'm reading, they are already talking about how they can buck this, but that is going to be a very patchwork situation. And once again, I say this to my friends, we can't individually get ourselves out of a collective health crisis. You know, you can take all the precautions that you can against COVID and still get COVID. And same thing with polio, with the measles. These things were things of the past because of our robust public health system. And we may end up getting put on advisements for travel and flight watch from other nations, I'm hearing. So we may not be able to go places now or have people come to us. That's another repercussion I don't think people are thinking about here.